Good afternoon. Today, I represent the Board of Medicine and the Professional Regulation Commission. I will be discussing the role of PRC in the reorientation of healthcare professional education towards primary healthcare. The journey to become a doctor is a long one. It starts with acquiring knowledge in school, then developing one's clinical skills in the hospital. In the Philippines, before an individual can work as a physician, he or she must pass the physician licensure examination or the board examination for medical practitioners. This is mandated by Republic Act 2382, or known as the Medical Act of 1959, as amended by Republic Act 4224 and Republic Act 5946. This is the law that governs the practice of medicine in the Philippines. The competencies that are supposed to be mastered by a physician are likewise expressed in the law. The examination is composed of 12 subjects, from basic subjects such as anatomy, biochemistry, microbiology, physiology, pathology, and legal medicine, to clinical subjects such as medicine, pediatrics, pharmacology, obstetrics and gynecology, surgery and its specialties, and preventive medicine. The physician licensure examination is given by the chair and members of the Professional Regulatory Board of Medicine. In order to ensure quality of examination, the validity of the exam year after year, the examination questions are developed by the Board of Medicine, guided by a matrix described in the table of specification, prepared for each of the subjects. The table of specification, or TOS, reflects the medical curriculum, the trends in diseases, and the top 10 causes of morbidity and mortality. It focuses on what is expected of a general physician and tests the competencies needed by a general physician. In addition to the subject matter included in the board exam, the table of specification provides standardization in identifying the subtopics in each subject, allocation for each subtopic, and the degree of difficulty of the questions to be asked. The current TOS utilized by the Board of Medicine was crafted in 2009. It must be mentioned that the policies, standards, and guidelines, or PHC, for medical education was developed and described in the CHED Memo Order 18, series of 2016. It was thereafter implemented by the medical schools. Expectedly, the first graduates of the CMO 18 would have taken the board exam in 2021 or 2022. At present, the Board of Medicine is in the process of updating the TOS to include provisions mentioned in the CMO 18. Stakeholders meetings are conducted with APMC, CHED, and the Department of Health. Recent events has now introduced universal healthcare principles in medical education through Republic Act 11223. There are already coordinations between DOH, APMC, and CHED regarding reorientation of healthcare professionals' education. As the medical school introduce UHC in their curriculum, this will then be incorporated in the table of specifications and the PLE by the time the first graduates take the board examination. Considerations on whether it will be incorporated in one subject, such as PrevMed, or in each subject will be considered when the TOS will be drafted. In the end, the Board of Medicine will not be primarily responsible for the reorientation towards primary health care. Our role is to ensure that the primary healthcare principles are incorporated in the board examination for upcoming doctors and to ensure that the primary healthcare is reinforced through continuing professional development programs offered to registered physicians. Thank you. But before I go, may I introduce to you the current composition of the Board of Medicine. We have Dr. Godofreda Dalmasian, Dr. Zenaida Antonio, Dr. Martha Newcomb, Dr. Efren Laksamana, and Dr. Joanna Remo. From the Board of Medicine, thank you and good afternoon.